clinical interest is pediatric congenital colorectal malformations. This specifically includes a disease entity known as Hirschsprung's disease, as well as congenital anorectal malformations. I'll start with Hirschsprung's disease. Hirschsprung's disease is a congenital malformation that affects newborn babies where a portion of their intestine does not have developed nerve cells. So what happens is that the intestine doesn't function properly in propelling the intestinal contents through the colon and through the intestine. So the role of the surgeon in this particular type of disorder is to identify this particular disease and then to correct it. If it's diagnosed in the newborn period, what we can do is we can perform biopsies, which are taking small samples of tissue to confirm the diagnosis. And then with a small incision around the belly button, we can actually remove a portion of the colon through the anus and rectum and bring the healthy colon down and correct the problem with minimal scarring and complete correction in the newborn period. We also treat complex congenital anorectal malformations. We are one of 2 or 3 centers within the New York metropolitan area which treats the full level of these complex congenital anorectal malformations as well as cloacal malformations. These are very complicated birth defects, which involve not only the colon and the rectum, but involve the urinary tract, the genital tract, and involve complex urologic, genitourinary, and colorectal reconstruction. We collaborate with our urologic colleagues in the operating room to correct these complex malformations, and they usually involve separating the urinary tract from the colorectal tract and then performing these reconstructions. The CADC provides a multidisciplinary service in order to manage these patients. This gives us the added benefit of not only being able to operate on these patients to treat these complex malformations, but to be able to diagnose the problems, treat them, and manage these patients indefinitely throughout infancy, childhood, into adulthood. We rely on our subspecialists for this multidisciplinary approach. Our gastroenterology colleagues help us make the diagnosis. They provide high-level technologic advances for following these patients. Endoscopic techniques are very helpful in the management of these patients. Manometric techniques help evaluate continence. We rely on our urologic colleagues for the co-management of these malformations, and our pediatric radiology colleagues for the diagnosis and follow-up of these complex patients. The CADC provides this multidisciplinary type of team approach to the management of these problems, which is not only indispensable, but is not really present elsewhere in the New York area. Our patient navigators, our colleagues, the availability of multiple specialists allows us to diagnose and treat these patients and provide lifelong follow-up for these children as they progress into adulthood with these multiple complex problems.